I'm John Olmsted. I'd like to take just a few minutes of your time to talk about our patient care culture and then ask your help in maintaining our high standards. We were all taught when we get into healthcare that all interactions around patients are expected to be highly professional. This patient care culture frowned on any non-patient focused care or talk. And certainly anyone caught violating this standard would be quickly ushered off stage away from the patient.
Shut up!
We have to recognize, though, that as a country, while our quality of life has greatly improved, we've also accepted a much higher degree of incivility in day-to-day life. This is not a slam on the younger generation. It's our entire culture. For example, just look at our taste in TV shows and our taste in music. No one can deny that we've embraced a much higher degree of incivility in day-to-day life. They say times change, but people don't. But I think our culture has changed. And this change has bled over into our patient care culture. Actions such as talking with friends about parties or weekend activities in front of patients have become much more commonplace. Now, we can argue about whether that's a big deal or a little deal to the patient, but we can't deny that there's been a general degradation in our patient care culture. This degradation violates our mission as healthcare professionals. We have the privilege and honor of working with these patients in the most important time of their life. They deserve the patient care perimeter. The patient care perimeter is any area within earshot or eyeshot of patients and visitors. It's not geographic specific. It's not the patient's room or a hallway or a waiting room. It's anywhere a patient or visitor can see you or hear you. The patient care perimeter needs to be treated as sacred territory. The word professional doesn't quite describe what we're talking about. Everybody wants to work in a professional environment. But what exactly does that mean? The word sacred describes the level of respect and dignity our patients deserve. The patient care perimeter is a healing zone where the patient will experience serenity in an acutely collaborative and respectful environment supporting the dignity of the patient. Everyone, religious or non-religious, understands that in the middle of a religious ceremony, you don't pick up the cell phone and chat with friends or tell jokes. And again, if someone does violate that understanding, people around them quickly let them know. Our patients deserve that same level of intensity during what's the most critical time of their life. I'm asking for your help in maintaining our culture of excellence in this era of increasing incivility. There's just 3 things I'd like you to look out for. First, look out for your patients. If you see someone being rude, slamming clipboards, or slamming drawers, make sure to protect your patient. Pull them out of the patient care perimeter. I completely empower you. Make sure to always look out for your patients. Number 2 is look out for each other. Now, when I was staff, I was never rude to patients or family, but there probably were a few times where I was a little loud, telling a funny story or talking about my weekend. While it's not the end of the world, it does violate our mission in our patient care perimeter. Now, we want people to be themselves at work, but to be honest, a patient who's dealing with staggering medical bills or has just found out they have life-threatening cancer probably will not be amused by a bald guy telling a knock-knock joke. So look out for each other. The third point is look out for your institution. If you care about patients, you have to look out for the institution. Remember, a big part of a patient's recovery is their faith and trust in us as caregivers and our institution as a whole. Some examples. When walking down a hallway, if you spot a piece of trash, pick it up. Hundreds of people could pass that piece of garbage in the hallway before housekeeping has a chance to get to it. Facebook and social media is a great way to keep in touch with friends. But don't talk about work on Facebook. It's too easy for people to take things out of context and frown upon the institution as a whole. If you spot a visitor who seems lost, don't give them directions of where they need to go. Walk them there. Make sure to close the loop and take them to their destination. They need to see their loved ones. And always wear proper attire at work. People do judge a book by its cover. A professional uniform goes a long way to instilling public confidence. Please look out for the patient, each other, and the institution. If we all work together to protect the patient care perimeter, our culture of service excellence will remain as strong as ever. That's exactly what our patients deserve. Now let's get out there and make the difference.